When I think about urology and innovation, there aren't too many other topics I can think about within our field that are as polarizing as penile augmentation. And today's session really emphasized the different conversations surrounding this area. And a lot of people, they hear one story or they hear about one complication, or they just have like this thought in their mind about what this procedure entails. And so I think that when you hear one story, you just have sort of one view of what's going on. And so the beauty of this session is we actually had 2 abstracts in a row talking about the use of hyaluronic acid for penile girth enhancement. And really at the very basic level of offering this procedure is understanding the safety. There are a lot of things that I can offer patients in clinic, but I always ask myself first, how can I hurt this person? Because it's one thing if something is very effective. Chemotherapy is very effective for killing cancer, but it also has adverse events. And so really we have to understand the safety of these therapies. And what we found is, in a retrospective review of nearly 500 patients over a 3-year span, none of those patients reported erectile dysfunction, none of them reported loss of penile sensation, and none of them required a trip to the operating room for intervention. And so a lot of this perception of what penile augmentation is with the other studies that use, let's say, permanent filler, where actually some of those patients do require a trip back to the operating room. And so, but it's a very different intervention. And the more research we do in this field and the more that we talk about this very taboo and stigmatized topic, I'm hopeful that it's going to encourage more and more people to consider it and do research, because there's still a lot more we need to learn.